Hello, hello everyone. Welcome back to the channel. Um, Thank you so much for joining me this afternoon. Glad to have you in the stream. Let's just have a quick look and see what's going on. So if it's the first time that you're joining one of our streams, lovely to have you on here. Welcome to AskAwayHealth Live. I'm your hostess. My name is Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth, and I'm interested in general health, but particularly in women's health issues, sexual and reproductive health as well. And if this is the first time that you're coming across my channel, I'm really pleased to have you here. On this channel, we have videos discussing trending medical, health, wellness, and lifestyle topics to educate and help us get the best and the most out of life. Usually we publish a new video every Thursday evening, but we have these Sunday live streams where I like to spend maybe 20 minutes, half an hour just chatting about topical issues that I've noticed or people have asked about during the week. And so I hope that you can make it a date whenever you can. You can find us on social media on AskAwayHealth. Our website is askawayhealth.org. And of course, here on the YouTube channel, and you'll find the links to all our social platforms in the description box below. So make sure you find one way or more to connect if you haven't done so already. I'm just going to have a quick look at the chat, see if anyone's lingering on there. Say a couple of hellos. Yeah, a couple of people on the chat already. Say hi so I know who you are. But let's get started. Today's topic, I think it's one of interest and relevance. So let's jump into it. Pregnancy stories. Why are we discussing this topic? Really interesting. I think one of the questions behind this is whether we as people generally, whether you're a healthcare professional or whether you're the man or woman or the couple who are pregnant, are we glossing over how women could develop some serious health problems or concerns around pregnancy and childbirth? And this came about from a Twitter thread that was created by a lady sometime during the last week. And by this afternoon, when I looked last, it had generated over 10,000 likes. I'm going to place the link to the thread in the description box. So if you're interested in following it and see all the discussion going on there, you can just click the link and find out. But obviously that volume of interest indicates the popular issue, and there's so many opinions when you look at that thread, supporting some of the claims about challenges in pregnancy, some disagreeing, both men and women chipping in their own opinions. But I think a lot of what caught my attention was some women particularly saying, oh, I wish I'd known this, or I wasn't well prepared. And I think that's an area where we could do a lot better. And I felt introducing this topic was a good way of addressing that area where you might not realize that this could be a possible complication in pregnancy. Now, other users shared about their own very good and smooth experience during pregnancy and afterward. So it's about really maintaining a balance. Some people have a simple, straightforward, stress-free, no complications outcome in the pregnancy, and others might not. And it's about having a balanced view of things and being as well informed as possible. Now, when you add that into the mix of the challenges that people in countries like Nigeria, for example, and other low middle income countries could experience, for example, lack of key essential infrastructure like health centers, equipment, a high poverty index, poor access to nutrition, poor access to healthcare, cultural issues like child pregnancy, the lack of awareness of risks with pregnancy, issues around healthcare workers training, including traditional birth attendants. There's so many different factors that can contribute to the poor outcomes that exist in terms of mothers having successful, smooth outcomes in pregnancy and having a good maternity mortality rate as a country, which is the rate or ratio that we use to look at the number of deaths of mothers in pregnancy. Nigeria does have one of the highest rates, and so it's good to have a look at what the factors that contribute to that and how we can address them. One of the things that we would look at in this series is breast problems around and after pregnancy. I thought we would start with that. I've got a host of other topics that are relevant, and hopefully over the next few weeks as we start this and go into other topics, hopefully we can create a lot of that awareness that contributes, that the lack of which contributes to poor maternal mortality rates in countries like Nigeria. So let's begin. Breast changes in pregnancy. Generally, the changes to a woman's breast happen because of the hormones which are preparing the body to carry the pregnancy and support the baby after birth. There are lots of hormones involved in all this, but the more common ones, particularly in the early stages, are the hormones estrogen and progesterone. And some of what they do is they cause more blood flow towards the breasts. They cause the breasts to retain fluid. So insensitive. That's a very common early observation by many women who are pregnant. And so from about 6 or 8 weeks of pregnancy, the breasts are getting bigger in size, and this growth carries on throughout the pregnancy. Many women find that they might go up a cup, 1 or 2 cup sizes. And as the breasts get bigger, the skin of the breast stretches, which can cause itching and lead to stretch marks. So this is one of the reasons why this might happen. You might experience it, you might not, but it is a possibility, and this is why. The other things that could happen are that the area around the nipple that we call the areola, slightly darker around the nipples, in pregnancy gets even darker because of the hormones which affect the skin pigmentation. So that's something else that you can expect to happen. You might also notice that the veins, the blood vessels under your skin look darker or more pronounced, might be a better way of saying it, because of the increased blood supply to the breasts at this time. From the end of the first trimester, so the trimester is 12 weeks, so from about 12 weeks, some might start to experience leaking. So they might experience leaking of a yellowish, thick substance that's known as colostrum. It's also called pre-milk, and this is the body getting ready to start providing the nutrition that the baby will need. Some women might lick this fluid. They might find that they get a bit of discharge from their breast. Some women do not at all. But colostrum is, like I said, is pre-milk. It's sweet, watery fluid that's easy for the baby to digest. So it's early food for the baby. Now, the key challenges that you might experience at this time, because that's the main thing really that might happen with the breasts during the pregnancy. Of course, there are other issues, but I just want to limit the discussion to the more common things that you might see. So the key challenges are tenderness and soreness of the breast, very, very sensitive. And so it's really important to have a well-fitted bra. Remember that we said that your bra size might go up 1 or 2 cup sizes. So it's really important to be looking at the appropriate maternity bra that fits properly. And it's important because a poorly fitted bra can lead to complications and lead to problems with the breast, which we'll look at a little bit later in this discussion. Avoid bras that have underwires. Go for cotton bras. A sports bra would help, particularly if you're remaining active during your pregnancy. And if you're on the large side or on the big side, look for soft, non-restrictive bras, cotton bras that you can wear to sleep, because that helps with dealing with sensitivity and soreness of the breasts. So a lot is going on as your body is getting ready for the baby, and the breasts are not left out. Don't forget, you also have the milk ducts, which are also getting bigger as they prepare for the job of helping to deliver milk to the baby after it's born. So that can also contribute to soreness of the breast. So that's looking at some of the events that happen during the pregnancy. Now, what about after birth? And a big chunk of the issues does come up in this period after birth. Breastfeeding is a natural way to feed the baby. That said, there could still be a few issues about getting it right. So just because it's a natural way to feed the baby doesn't mean that it naturally happens and it's all there as soon as you start trying to breastfeed. It's really important that we let mothers, expecting mothers, new mothers know that it's a skill that you could take some time to learn. So there shouldn't be any pressure or expectation that as soon as the very first time you put the baby to breast is all going to go honky-dory, everything goes well. There may be a few challenges before you get used to it. But after the baby is born and you intend to breastfeed, there are some problems that could arise, and I'm going to look at them. There are things like a low milk supply, having sore nipples, dealing with engorgement, a condition known as mastitis, and also thrush, developing thrush on the breast or the nipple, and difficulty latching on. So let's get into it. And hopefully we'll be able to cover that within the next 15 minutes or so. So what's a low milk supply? This is when your breasts are making enough milk for the baby, and not making enough milk for the baby, I should say. Could happen for a variety of reasons. If you were ill just as you were having the baby or just before the baby, or if you didn't start breastfeeding straight away after birth for whatever reason. It's really important to get into the routine of feeding your baby as often as they desire, because as you'll see when we talk about hormones, this empties the breasts, the baby's feeding empties the breast and gives your body the alert through your hormones that more milk needs to be produced. So it's really important to tune in with that and feed baby as they demand, as we say, as they demand. And the other thing that can help with your milk supply is eating a regular, balanced diet and drinking plenty of fluids to help with milk production. And I'd love it if anyone in the chat can put their thoughts or experiences about, in African tradition, it happens in Nigeria, I'm sure it happens in other countries. There are lots of delicious herbal preparations, soups and drinks that relatives prepare for new mothers to help them recover from childbirth and also help with things like milk production and milk flow. So if you have any of those herbs, or you know the names, put them in the description, put them in the comments, please. It'd be lovely to see what we have from different countries around the world. Right, the next thing to talk about is sore nipples. Sore nipples can be a big challenge, and they can usually happen if the baby is not taking in enough of the nipple and the areola. So we're now talking about the technique when it comes into latching, getting the baby to latch properly on to the breast. So key things to know here to try and prevent sore nipples from developing are that the baby's mouth needs to be open wide enough to allow a good amount of the areola that's area of the breast immediately around the nipple to go into the baby's mouth, as well as the nipple, so that they're actually sucking around the nipple area on the areola and not just sucking on the nipple. Avoid them pulling at the nipple, because what the baby needs to do is to suck, exert pressure on the milk ducts within the breast and the areola to release the milk. So you might think that, oh, baby's sucking on the nipple. You actually need baby sucking on that fleshy area around the nipple. So that area has to be in its mouth as well as the nipple to get the proper suck mechanism going on and to reduce any pressure on the nipples. Now, if your baby happens to have managed to trap the nipple alone in their mouth, you can use a clean finger to just sort of stroke at his mouth and insert into the corner of the mouth to release or dislodge your nipple and then reposition the baby. Because if they carry on sucking at the nipple and putting pressure on the nipple, you can then end up with cracked or bleeding nipples. That pressure and sucking that they're doing needs to be on that fleshy area, on the areola, should be concentrated in that area. But if you do get sore nipples, cracked nipples, how do you deal with them? In the very early instance, you can use your breast milk. You can rub a few drops of your breast milk over your nipple if you notice that it's sore or you think it's starting to crack. Use clean fingers, please, and then let your nipples dry in the air. and do this after feeding. Breast milk has natural healing emollients, and of course, it's readily available to you. You don't have to go and buy your breast milk. Or you can get breast emollient cream containing lanolin to apply to your breasts after feeding, again, to help keep them supple, help keep the skin healthy, reduce the risk of cracking and bleeding. And be watchful about some maternity bras, because some synthetic fibers could irritate the nipple and contribute towards the problem. Let's just check back in with the chat. I'm going to press the wrong button again. What have I done? Okay. Hello there from Abisisu Concepts. Nice to have you on board. Thank you for joining in. We've got a couple of people here who are sort of hiding away and not saying anything, but I'm glad that you've taken time to join. So thank you so much, Abisisu, for saying hi, for dropping by. I appreciate that. Okay, so let's carry on. We've looked at sore nipples. Now let's also take a look at engorgement. Engorgement, that's really an important complication of breastfeeding. Engorged breasts happen when the breasts become hard, heavy, and painful because they are too full of milk. It's something that's most likely to happen in the first week of breastfeeding, while you adjust to your baby's needs, because each baby is different, and so you're sort of trying to get into a routine and a pattern. Now, the milk ducts or the channels in the breast can become blocked and lead to the fullness of and the heaviness of the breasts. It can develop if there are long gaps between feeding. That's when it's most likely to develop, when you allow the breast milk to accumulate without letting the baby empty the milk, and it accumulates in the breast. But poly-fitting bras or even car seat belts that's strapped tightly across your chest could put pressure on the milk ducts and lead to engorgement as well. So the ducts become plugged, and that reduces the milk supply. Because the breast is hard, the nipple is flat, so the baby can't really latch on properly, because you need a nipple that the baby can sort of, in terms of latching on, able to hold on to as the nipple and the areola gets into its mouth. If that nipple is flat, it's difficult for the baby to root and then open its mouth properly to grab onto it. So engorgement can cause difficulty with feeding. But to prevent it developing, the important thing is to breastfeed, or if you're using a pump or using your hands, to express as soon as possible. In terms of a routine, it might be necessary to nurse at least 8 times or even more in a 24-hour period. Again, of course, depends on yourself and your baby's routine. And try to get in about 15 minutes for each feed. It's really important to feed on both breasts at each feed as well. We talk about foremilk and hindmilk, both essential components of milk for the baby, but it also helps to ensure that the breasts are being emptied and preventing engorgement. So when you have to be away from the baby, for example, if you're nursing and you're back at work, plan ahead, use a breast pump or express by hand at the same time that you would normally feed, and this is all to prevent engorgement from developing. But if you do develop engorged breasts, the things that you should do are continue breastfeeding and expressing often, because you just have to release the excess milk. In addition to that, having alternate warm showers followed by cold compresses can help to relieve the discomfort. And of course, if you're in that much pain, then taking medicines like simple paracetamol could help to relieve the discomfort while you're trying to express the milk and feed to reduce the excessive amount of milk in the breasts. It's very important to know that engorgement should be tackled fairly quickly, because if you allow it to persist or to continue, a condition known as mastitis can develop, and that's where you have inflammation of the breast tissue. We'll talk about that in next, actually. So it's quite common, the condition mastitis. 1 out of every 5 women who is breastfeeding could develop it. It's most likely to happen if there's some damage to the nipples, and like we've just been talking about, engorged breasts, or if a woman is using nipple shields. In some cases, it might be because of an infection coming through the nipple, and it's something that can progress very quickly from blocked ducts, engorgement. The next thing you have mastitis, and then it might end up as a breast abscess, which is where you have a collection within the breast itself. Now, an infection is more likely if you have a cracked nipple, and the infection affects the fatty tissue of the breast, which then causes swelling that pushes on the milk ducts, closing them even more, and then causing you to have pain, develop swelling of the breast, and even a lump. Some women feel the breast and they can actually feel a lump within the breast tissue. Now, if it gets to that point where you're getting pain, swelling, and lumps, you might even feel unwell. You might develop a temperature, feel headache, feel as if you've got flu, chilly, feel tired, as if you've got malaria, those kind of symptoms. That you might need to have antibiotic treatments. And if it's not settling down, or if there's a defined collection within the breast, it might be that an abscess has developed and that needs treatment with drainage. So that means a doctor needs to go into, in hospital with a needle, go into the breast tissue to release or to relieve the abscess collection. And of course, you complete some antibiotics to clear out the infection. Now, if possible, if you're not in too much pain, you should continue breastfeeding or pumping or expressing to relieve the engorgement while receiving your treatment. And let's talk about, so we've talked about low milk supply, we've talked about sore nipples, engorgement, and mastitis. Let's talk about thrush, because that's another common problem that women could develop. This is where there is a yeast infection of the nipple. And of course, thrush can happen pretty much so many different parts of the body, but this specifically affecting breastfeeding, when there's a yeast infection of the nipple. Most often, your baby might have thrush in their mouth as well at the same time. And so usually the treatment will be for both yourself and the baby. How do you tell if you have thrush? For some women, there's sort of a burning sensation of pain around the nipple, or there's a deep pain in the breast, but it doesn't appear to be. There are no signs of mastitis. There's no sort of swelling or redness around the breast. There isn't that feeling of being ill, but there's just that pain. And there might be signs of thrush in the baby's mouth as well. So the general treatment, or the usual treatment, is using antifungals. Antifungal cream can be applied over the breast while the baby is given antifungal treatment that goes into the mouth, coats the mouth. In some instances, if the thrush is difficult to treat, if it's not settling down, then the mom may also need to have treatment by mouth. So that's how thrush is, that's how we deal with thrush. Now, latching on is a challenge that many new moms report. And again, doing it right is a skill. So don't get yourself down. Don't let anybody sort of make flippant, careless remarks and just get on with it. If you can, get a lactation counselor, or open up to your midwife if you haven't got anyone else that you can talk to ask for advice, to show you, to support you and provide and demonstrate both feeding positions, how to hold the baby, and latching on positions. I found a good video which I think really helps demonstrate it, and I'm going to put the links in the description box below. It's on YouTube. So make sure if you're having issues with latching on, have a look at that video and see if it's something that could make a difference for you. So before I round up the chat this afternoon, let's talk about hormones when breastfeeding. Like I said, there's so many hormones going on in your body, or so many hormones active and doing different things in the body when you're pregnant. When it comes to breastfeeding, two of the important ones are known as prolactin and oxytocin. Prolactin stimulates the cells in the breast to produce milk, while oxytocin stimulates other cells also in the breast, so that the milk that is produced flows into the ducts to be released into the baby's mouth during breastfeeding. Now, both are stimulated when your baby sucks, and they both work together to help the baby feed on the milk that's already there and help to produce fresh milk, getting ready for the next feeds. Oxytocin also does more. Some women complain about the severe pain in their womb when they're feeding. This is because oxytocin also makes the mom's womb contract after delivery. And it's doing that to help to reduce the bleeding associated with the bleeding from the blood vessels in the womb. So it's just helping to get the womb back to its normal size after birth, which is an important job. But those contractions can cause severe pain, and they are stimulated when the baby sucks. So some women, for a few days, may experience that. That's the cause. It's something that will settle down with time as the womb returns back to its normal size. The other thing that's really important to say about oxytocin is how it could affect a woman's emotions, which could then go on to affect breastfeeding. The oxytocin reflex is conditioned to what to your senses as a mom, the way you feel. So it's just touching your baby or smelling the baby's, breath or milk or, baby stuff, hearing baby cry, or just thinking lovingly about the baby can cause oxytocin, can stimulate oxytocin to produce, and your breast could be stimulated and you start flowing with milk, even though baby is not suckling at the breast. And conversely, if the mother happens to be in severe pain or she's emotionally upset at any time, that oxytocin reflex could be affected so that milk may stop flowing, which affects breastfeeding. So I just brought this out to show how it is tuned into the mom's emotional state, and that could also be related to breastfeeding. Now, obviously, that happens if it's where there's emotional upset or pain, and the mom is supported and she gets over it, she feels more comfortable, and the baby can continue breastfeeding, then the milk flow can continue. So that's a quick look at some breast issues. There's different things. I've not covered everything here, but I thought it was good to start a discussion, and the important thing is about creating the awareness. And if you do have any experiences of being pregnant and developing problems with breastfeeding, please share in the comment section so that we can learn. If you've got any questions, ask. I'll be happy to attend to them. Like I said, the links to the Twitter thread and the links to the breastfeeding demonstration video, I'll put them in the description box below, and so you can have a look at them at your leisure. So guys, I would like to round up now. Thank you so much for spending part of your Sunday with me. It's really good to have the attention. I appreciate you guys. Next week, hopefully, we shall continue on the pregnancy stories series, unless something else comes up that might be a bit more relevant to discuss at the time. But I'm really keen to take it to the point where there is some growing awareness on key issues. So we might be looking at things like postpartum depression. We might be looking at things like episiotomy, that's getting a cut in the genital or vaginal area, the perineum around birth, why that happens, how to deal with it, and so on and so forth. It does cause a lot of issues with new moms. So thank you so much for joining. I will see you again. Make sure you stay well in the coming weeks. Stay safe, everybody, and take care. Bye-bye.